Good morning. My registration number is D16233. Good morning. Glycosylated hemoglobin is the gold standard for assessing the blood glucose concentration of a patient over the 3 months. And the aim of the study is to investigate the independent association between the severity of diabetic retinopathy and glycosylated hemoglobin level in Meghalaya. The association between the glycosylated hemoglobin and severity of diabetic retinopathy was done in previous studies along with duration of diabetes, systemic association like hyperlipidemia, hypertension, socioeconomic status, etc. But the independent association between these two has not been explored much in population-based studies. That's why this PREDENCE study was undertaken. It was an observational study done in a 420-bedded multi-specialty mission hospital in Northeast India from January 2011 to December 2016. This study employed both cross-sectional and prospective analysis. In cross-sectional analysis, data from the last examination of 2,000 diabetic patients were used. Data means glycosylated hemoglobin level and fundus finding. In the prospective analysis, 300 diabetic patients free from retinopathy at their first diabetic examination at which glycosylated hemoglobin level were measured were followed up. Screening for retinopathy and glycosylated hemoglobin level is done in each follow-up visit of every patient. Results: patients were classified into 3 age groups depending on the presence of their retinopathy. Number 1, diabetic but no evidence of retinopathy. These were classified as no DR. In the second group, these are diabetic patients having non-proliferative diabetic retinopathy. They are classified as non-sight-threatening diabetic retinopathy. And in the third group, these are patients having severe non-proliferative diabetic retinopathy with proliferative diabetic retinopathy and clinically significant macular edema. These are grouped as sight-threatening diabetic retinopathy. Out of 2,300 patients with retinopathy, 57% had shown no evidence of retinopathy, while 43% showed the evidence of retinopathy either in sight-threatening or non-sight-threatening. Patients were again classified into 3 groups depending upon their glycosylated hemoglobin value. If it is less than 7, we considered them as control. Level between 7 to 9 were considered as poorly controlled, and level above 9 is considered as uncontrolled. While analyzing the frequency of diabetic retinopathy in every group, it was found that in control group, out of 920 patients, 136 patients developed retinopathy. That means 14.8% developed retinopathy. In the poorly controlled group, out of 598 patients, 313 developed retinopathy. Almost half of these patients developed retinopathy. And in the third group, out of 782 patients, 540 developed retinopathy, almost more than 2/3 of these patients. In patients who had glycosylated hemoglobin value between 7 to 9, there were significant relationship between diabetic retinopathy and glycosylated hemoglobin level. Among 300 diabetic patients without retinopathy at baseline, 34 subsequently developed retinopathy during follow-up. Out of 34 subjects, the new retinopathy all had non-sight-threatening diabetic retinopathy. So discussion: the inclusion of glycosylated hemoglobin in the screening protocol has gained significant importance not only in the diagnosis and management of diabetic mellitus but also on the onset and progression of diabetic retinopathy. Even short period of higher HbA1c level could have sustained effect on worsening of retinopathy despite subsequent improvement in glycemic control. Earlier reports showed that prevalence of diabetic retinopathy is significantly increased at value between 6 to 7. Later, a value of 6.5 was seen to be a cutoff at which